Good morning. I am Maria Lira Catalan, RN USRN, and today I'm talking to you about nursing audit. So, what is nursing audit? Nursing audit is the process of collecting information from nursing reports and other documented evidence about patient care and assessing the quality of care by the use of quality assurance programs. It is a way to find out if healthcare being provided is in line with standards and lets care providers and patients know whether service is doing well and whether there could be improvements made. What is the purpose of nursing audit? It evaluates nursing care given. It achieves the deserved and feasible quality of nursing care. It is a stimulant to better records. It focuses on care provided and not on the care provider, and it contributes to research. Excuse me. The history of nursing audit. Nursing audit is an evaluation of nursing service. Before 1955, very little was known about the concept. It was introduced by the industrial concerns. By the year 1918 was the beginning of medical audit. George Groward pronounced the term for the first time as a medical audit. 10 years later, Thomas Pondon, also a doctor, established a method of medical audit based on procedures used by financial accounts. He evaluated the medical care by reviewing the medical records. The first nursing audit report of the hospital was published in 1955 by Pondon. For the next 15 years, nursing audit is reported from study or records on the last decade. The program is reviewed from nursing plans, nurses' notes, patient conditions, and nursing care. So, what are the types of audit? There's the external and the internal audit, and internal both retrospection, concurrent, and peer review. The external audits is usually comprised of studying the financial statements that are written records that convey the business activities and the financial performance of a company. It, also, the balance sheets, which provides an overview of assets and liabilities and shareholders, the equity as a snapshot in time. The income statements are primarily used and focuses on the company's revenues and expenses during a particular record. Once expenses are subtracted from revenues, the statement produces a company's profit figure called net income. The cash flow statement, or the CFS, however, measures how well a company generates cash to pay its debt obligations, fund its operating expenses, and fund investments. So, audits can include a review of both financial statements and a company's internal controls. For the internal audit, a retrospective audit or review, a concurrent audit or review, and a peer review could be made. So, methods of nursing audit for a retrospective review. This refers to an in-depth assessment of the quality after the patient has been discharged and have the patient's charts as a source of its data. Retrospective audit is a method for evaluating the nursing quality care by examining the nurse's care as it is reflected in the patient care records for discharged patients. In this type of audit, specific behaviors are described, then they are converted into questions, and the examiner looks for answers in the record. Examples of retrospective review was the problem solving process used in planning the nursing care, whether the patient data collected is in a systematic manner, was a description of the patient's pre-hospital routines included, were laboratory test results used in planning care, did the nurse perform physical assessment, how was the information used, and then were the nursing diagnosis stated, and did the nurse write the nursing orders, and so on. So the concurrent review, this refers to the evaluations and audit conducted on behalf of patients who are still undergoing the care. It includes assessing the patient at the bedside in relation to predetermined criteria, interviewing the staff responsible for this care, and reviewing the patient's record and care plan. The third is the peer review. In nursing, it is the process by which practicing registered nurses systematically assess, monitor, and make judgment about the quality of nursing care provided by their peers as measured against professional standards of practice. The focus of peer review is practice. It is the mechanism used to A. Evaluate the quality and quantity of nursing care based on practice standards, B. To determine the strengths and weaknesses of nursing care based on practice standards, C. Provides evidence for change in practice protocols to improve care, and D. To identify practice patterns that indicate a need for more knowledge. So, there are methods to develop criteria for review. So, number one, define first the patient population. Two, identify a time frame for measuring the outcomes of care. Three, identify the commonly recurring nursing problems presented by the defined patient population. 4. State patient outcome criteria. 5. State the acceptable degree of goal achievement. 6. Specify the source of information. And 7. Design and the type of tool. But there are some points to remember. A quality assurance must be a priority. Those responsible must implement a program not only as a tool, and C. A coordinator should develop and evaluate quality assurance activities. The roles and responsibilities must be delivered. Nurses must be informed about the process and the results of the program, and data must be reliable. Adequate orientation of data collection is essential, and quality data should be analyzed and used for nursing personnel at all levels. So the audit committee, before carrying out an audit committee should be formed, comprising of a minimum of 5 members who are interested in quality assurance and are clinically competent and able to work together in a group. It is recommended that each member should review not more than 10 patients each month, and that auditors should have the ability to carry out an audit in about 15 minutes. If there are less than 50 discharges per month, then all the records may be audited. If there are a large number of records to be audited, then an auditor may select 10% of the discharges. So, audit is used as a tool for quality control. An audit is a systematic and official examination of the record process or account to evaluate the performances. Auditing in healthcare organizations to provide managers with a means of applying control process to determine the quality of service rendered. Nursing audit is the process of analyzing the data and the nursing process of patient outcomes to evaluate the effectiveness of the nursing interventions. The audits most frequently used in quality control include outcome, process, and structure audits. So, what is the outcome of the audit? Outcomes are the end results of care, the changes in patients' health status, and can be attributed to the delivery of the healthcare services. Outcome audits determine the results, if any occurred, as a result of the specific nursing intervention for clients. These audits assume the outcome accurately and demonstrate the quality care that was provided. So, example of outcomes traditionally used to measure quality of hospital care include mortality, morbidity, and the length of hospital stay. Another is process audit. Process audits are used to measure the process of care or how the care was carried out. Process audit is tasked oriented and focus on whether or not the practice standards are being fulfilled. These audits assume that relationships exist between the quality of the nurse and the quality of care provided. Next is the structure audit. Structure audit monitors the structure or setting in which patient care occurs, such as the finances, nursing service, medical records, and environment. This audit assumes that a relationship exists between quality care and appropriate structures. These above the audits can occur retrospectively, concurrently, and respectively in the future. For the effective quality control, the nurse manager has to play its roles and functions. The advantages of nursing audit: it can be used as a method of measurement in all areas of nursing. The seven functions are easily understood. The scoring system is fairly simple, and the results are easily understood. It assesses the work of all those involved in recording care and may be useful as a tool as a part of a quality assurance program in areas where accurate records of care are kept. But what about the disadvantages? Uh, appraises disadvantages of nursing audits. It appraises the outcomes of nursing process, so it is not so useful in areas where the nursing process has not been implemented. Many of the components overlap, making the analysis difficult. It also is time consuming and requires a team of trained auditors. It deals with a large number of information. It only evaluates record keeping, and it only serves to improve documentation, not the nursing care. So, in conclusion, the nursing audit is of great importance and relevance in nursing practice because it helps the nurse managers or administrators to ensure that patients receive quality care. Planning in practice, nursing practice is easier and resources are well allocated. It also ensures that accurate records of nursing care are well kept, and it monitors the roles of staff and aids in their job evaluations. So that is the end of my report, and these are the references. Thank you for listening.